Okay, this video we are going to look at a few of the muscles of the pelvic girdle. Okay, so the first muscles that we're going to look at, and again, all the muscles that you're going to be required to know is in your objectives booklet on here. Although those are the ones that you're going to be responsible for naming as well as providing the action for. There might be some other extra credit questions in here as well, so you still have to pay attention. Okay, so let's look at the first muscle that we're going to be dealing with, and that's going to be the adductor magnus, and 1652 down here. Okay, adductor magnus. Now there's three different adductors that we're going to be dealing with. You just need to be familiar with the adductor magnus, and that's going to be this muscle here. Okay, so that's kind of more on the medial side. It's a fairly good sized muscle, as you can see. The action of this is going to adducts and flexes the thigh, flexes and medially rotates the thigh. Okay, so as this muscle contracts, you can imagine the femur kind of rotating in a little bit. That's medial rotation. So that's going to be the adductor magnus. Just briefly, there's going to be a few other adductors here. There's adductor brevis, which is a smaller muscle, and adductor longus, which is a little bit larger. So brevis, longus, magnus. Okay, and so that's it for this one. So let's look at the next one on the list. Or wait a minute. Okay, next one on the list is sartorius. That's going to be 1649. Okay. So there's a bunch of muscles in the anterior part of the thigh, and the primary one is going to be the quadriceps. So we're going to see a lot of muscles. We'll go into those individually here in a second, but those are your primary muscles of your thigh. That is going to be dealing with, the action is primarily knee extension that we're going to be looking at on this one. But we're going to look at, on this presentation one, the sartorius. What's interesting with this one is this muscle actually crosses two different joints. It's crossing the hip. Okay, so let me hide this one. Okay, if we can go back here. So here's going to be the hip joint. Let me hide that capsule so you can make sure you see that joint. Okay, so it's going to be crossing the hip joint, come back around, and it crosses the knee joint. Okay, so that's going to be an important, because it crosses two different joints, you're going to have motion at two different joints, so you're going to have different types of action. The action for the thigh, okay, up in here, what you're doing is you are flexing and laterally rotating the thigh, and at the knee you are flexing your leg, the lower part of your leg, and medially rotates the leg. Okay, so visualize, if this muscle is shortening, what is the motion that the hip is taking? Okay, if this is contracting, your leg is going to be going outwards. Okay, you're flexing the thigh. Okay, so it's like moving your leg anterior, like you're walking, that kind of stuff. So that one, it's going to laterally rotate the thigh. Distally on the tibia, when this muscle contracts, it shortens, you are flexing your leg at the knee, so your lower part of your leg is flexing, so you're bending the lower part of your leg back, so it's going back this direction, okay, while your front part is, your anterior thigh, or your thigh is going anterior, your leg is kind of going posterior. Visualize this, kind of stand up or sit down. Well, sit down and do this in lab so you can see what that motion is. Okay, so that's the sartorius, and then now let's do the other anterior thigh muscles, and let's look at the quadriceps. Let's look at this one. Okay, The quadriceps have 4 muscle bellies on this one. Just like the biceps, you have two muscles associated with that. You have the triceps, there's 3. Quadriceps is 4, okay? 3 of them have the first word being the same. There's going to be vastus lateralis, vastus medialis, and vastus intermedius. So, and I'll show those in just a second. The 4th muscle does not have the word vastus on it, but it's rectus femoris. So if you were to start front and center anteriorly, that's going to be this muscle. That's the rectus femoris. Now this one is crossing at the hip joint, okay? So this is going to be dealing with hip flexion or thigh flexion on this one. Let me go get to this muscle. So we're going to do hip flexion and knee extension. So all your quadriceps goes down into this ligament, which joins into the patella, which goes into the tibia. Okay, so when this shortens, you're going to have knee extension. And for the rectus femoris, you're going to have hip flexion as well. The other ones associated with the quadriceps are all going to be extension of your leg at your knee. So it's knee extension. The easiest way to remember, first of all, you just have to remember all 3 of these start with the word vastus, V-A-S-T-U-S. And these are just named basically by position. Out here, vastus lateralis. It's on your lateral side. Okay, so vastus lateralis. Go to the medial side, vastus medialis. Pretty simple. Okay, so the intermedius, any guess as to where that would be? Okay, it's going to be deep to this. So I'm going to highlight the rectus femoris. I'm going to hide it, and voila, vastus intermedius. Okay, so the vastus intermedius is going to be just deep to the rectus femoris. Okay, so here's a rectus femoris that I did not hide. So let me hide that one. And then that is the vastus intermedius. Notice that they all basically have the same origin and they have the same basic insertion. All 3 of those are going to be extension of the knee or extension of your lower leg at the knee. Okay, so you're straightening out your knee. So that's going to be this one. Let's do your gluteal muscles. Let's do the butt muscles. Okay, so we are looking at which ones do I need to do? We did adductor magnus, we did sartorius, glute max. We're gluteal. Let's just do this one. 1647. Your glute muscles. Okay, these are your butt muscles. Okay, there's actually 3 gluteal muscles. Well, technically 4, but 3 named gluteus something. And just like the quadriceps, where you have lateralis, intermedius, medialis, you have a glute maximus. Okay, maximum big. Okay, so this is a big old butt muscle. That's what you would normally see. Anybody working out at the gym will feel that muscle when they work out. Then you have glute medius on this one. Okay, so let's look at the action of the gluteus maximus. This is going to extend the thigh, so your leg's going to go backwards. It also is going to laterally rotate. So if you were to come down here, it's insert. Let me hide this muscle. You can kind of see the insertion. It's kind of the posterior lateral side. This is the femur. Okay, that's going to be the femur. So it's inserting on the posterior lateral side. So when it contracts, it's going to laterally rotate the femur, and it abducts. So if this is shortening, your leg's going to go out. Okay. The glute. Oops, let's go back. The glute medius on this one. Okay. This is the ilium or iliac bone. Okay, so this is the medius on this one. This is also going to abduct or abduct, and this one is going to be more of a medial rotation. Okay, so let me hide the maximus here for a second. Okay, this is going to be part of the femur. This is going to be more posterior, and it's pulling it around, so this is going to be more of the medially rotates it. Okay, the minimus, don't need to know this one. It's just kind of deep to the media. So let's put that up here. I'm going to hide the maximus, hide the medius, and voila, there's the minimus. Okay. Next one, iliacus, 46. Let's do this one. Okay, so the one that you need to be aware of is the iliacus. Okay, so here's the ilium or iliac bone, and this one is the iliacus muscle. The other, wrong button. The other ones that you see here are going to be the psoas muscles. This is psoas major, and this is psoas minor. Combined, the psoas major, psoas minor, and the iliacus is known as the ilio-psoas muscle. So iliacus for the ilio, psoas for psoas major and minor, put together, ilio-psoas. You will hear that referred to more than just iliacus. Okay, you'll usually hear ilio-psoas on that case. And the action of this one is flexion of the thigh. Okay. What other one do we need to do? We did quadriceps. Oh, posterior thigh. Okay, so we are going to be 1653. Okay, posterior compartment. We did the adductor magnus, remember that. Posterior compartment, that's going to be the hamstrings. Okay. On the hamstrings, the key thing on this that we're going to need to know, there are basically 3 muscles, 4 if you break down the biceps femoris. On this one, there's a starting point. If you were to start lateral and work medial on this one, so on the models, on the lateral side, posterior looking, and you can, one of the ways to identify this is you can see, well, let me bring this up. Okay, you can see these 2 muscles and it forms like this V shaped here. Okay, on the model, locate this. The lateral one is the biceps femoris. Okay, that's the biceps femoris. That one is actually, you have 2 heads to this. There's a long head and a short head. The long head is extending the thigh and flexes the leg. Short head just laterally rotates it. Just know biceps femoris. Key thing with this one, where's the other biceps? It's going to be in the arm. Okay, so if you're asked on a lab practical or a lecture test, and we ask you that muscle, and you only put biceps, whether it's on your arm or the leg, biceps will not give you a correct answer. You have to have biceps brachii or biceps femoris, because biceps alone can be a couple different parts of the body. Okay. Working medially on this one, then we're going to be semitendinosus on here. This is going to be extending the thigh, flexes the leg, and medially rotate. There we go. So if this shortens, you can see how this would rotate the tibial medially. You can see how this will be flexing at the knee. Okay, so it flexes your leg at the knee. And that one. So semimembranosus, again, working a little bit more medial. So remember, biceps femoris, semitendinosus, semimembranosus. And then you're going to have the adductor magnus in here. Don't forget that one. So this is semimembranosus, and this one is going to flex and medially rotates the leg and extends. So we're more on the anterior side of this. So this is going to extend the leg, extend the thigh. I'm sorry, extend the thigh. Okay. So that is the biceps femoris, semitendinosus, semimembranosus. easy way, well, I don't know how easy it is. Semimembranosus versus the tendinosis. Membranosus starts with an M, kind of. Not starts with, but the fifth letter in is an M, and that's on the medial side. Sometimes you just have to make things up to understand them, okay? So that's semimembranosus, and now let's do the lower leg. Let's go to 1655. Okay, I'll show you the anterior compartment as well. So the lateral compartment, so we've got anterior, okay, on this one. Let's go to the side, kind of in this one. We're gonna see two different muscles. These are fibularis longus and fibularis brevis. Long is longer, brevis is brief or short, okay? These are also known as the peroneus muscles, so peroneus longus, peroneus brevis. So if you end up working with an orthopod, oftentimes they'll say peroneus muscles, depending on your textbook that you use. Peroneus longus, okay, is going to be the longer of the two, most lateral muscle. This is going to evert the foot. Go back to a previous video where we talked about inversion and eversion. Okay, eversion. So if the toes are up in front, heel in the back, this is medial side, this is lateral side. Okay, eversion is where the foot kind of goes out. Okay, so it's an inversion sprain, but you're everting your foot. Okay, so this is the fibularis longus on this one. And this is going to evert the foot and plantar flex the foot. So again, shorten that muscle. You can see how the foot would flare out. And if we go under the bottom, you can see if it's coming across here, that pulls, toes will end up pointing down. That's plantar flexion. Okay. Fibularis brevis, it's a shorter muscle. They both are originating on the fibula. And this also causes eversion of the foot and plantar flexion. Posteriorly, we're going to have your gastrocs or gastrocnemius. This one. Okay, that's your big calf muscle. Okay, this is the gastrocs on this one. There's two heads to this one. It crosses the knee joint. So if you contract this muscle, your knee is going to move. So that's going to be knee flexion on this one. It's inserting into your Achilles tendon. Okay, so it's also going to cause plantar flexion of the foot. So if you shorten this muscle, pulls on this tendon pulls on the heel goes up, toes go down. Plantar flexion for this one. So that's the Achilles tendon on this one. Deep to this is the soleus muscle. So if this is the gastroc, that's faded out. So let me hide that one. Deep to that is going to be the soleus, and that's also going to be part of the Achilles tendon, causing plantar flexion of the foot on this one. Okay. So that, I believe, let me just go through all these muscles. We did the gastrocs, fibularis, membranosus, tendinosus, biceps femoris, quads, sartorius iliacus, glutes, sartorius adductor magnus. Okay, we covered all the muscles for the lower limb. Make sure you look at all the models in the lab, go through, and be ready for the quiz. Thanks a lot.